Stanislaus County is a mix of rural and urban atmospheres and environments. It's mostly Hispanic and Latinx and Caucasians, and there's a small percentage of African Americans.
There are disparities amongst different racial and ethnic groups in health outcomes across our county.
The data itself tells a very compelling story. When we break it down by zip codes or break it down by race, ethnicity, we see a lot of difference. You know, your health outcome depends on where you live, where you work, and where you play.
The resources they have matter. If we're talking to you about healthy eating, but you don't live in a neighborhood where there is any access to healthy foods, that obviously makes it very difficult. If you live in a community where you're saturated by tobacco retailers that are, first of all, prevalent, those are big issues.
¿Cómo nos tienen, no sé si la palabra sería marginados, olvidados a esta comunidad? En realidad me dio tanta tristeza que desde ahí yo decidí que yo quiero hacer un cambio para esta comunidad.
It's important that we understand what our biases are.
Looking more closely at some of these root causes, some of the things that keep people in poverty, looking more at that, I think, will help us move further and eliminate some of these terrible health disparities.
Through the San Joaquin Valley Public Health Consortium, we were able to join a cohort of 8 other counties to go through a year-long learning cohort and then an implementation cohort to be part of the GARE curriculum.
So GARE is the Government Alliance for Race and Equity. It's an intensive training so that you are continuously advancing equity.
The GARE project for us was really the jump start for the current public health leadership. This curriculum has given us some foundational knowledge to normalize conversations around racial equity and racism, and gain some tools that we can use to operationalize some policy change and some capacity building in our public health department.
But it's also how you work with not just the community, but your own staff, so that we're more empathetic and that we understand from a patient perspective what it takes for someone to come in.
When somebody comes through, like, I don't know what they've been through before they came to me. You know, you don't think about how hard it could be for them to even afford health care or find a doctor to see them or their children or get medicine for diabetes.
Me gustaría poder aprender para poder lograr hacer algo mejor para mis hijos. Porque ellos son el futuro de esta comunidad o de este país, son el futuro, y me gustaría poder lograr hacer algo mejor para que ellos crezcan aquí sanos, seguros.
The community wants to be involved in the decision-making process. It's our responsibility to ensure that we're responsive to their voices, and so we have started a range of different programs.
One of the programs that we've instituted in the airport neighborhood is the Powerful People program.
Muchísimas gracias por estar aquí el día de hoy para apoyar a todas las que se están graduando el día de hoy.
Tenemos a nuestro alcalde de la ciudad de Modesto, el honorable Ted Brandvold.
Powerful People has provided the tools to engage community residents at the grassroots level. They learn about communication skills, which they will be using when they connect with elected officials, when they connect with local government, when they connect with community residents.
Aprendí que unidos podemos lograr más cosas que siendo uno solo. Si nos unimos como comunidad, siempre es mejor. Aprendemos más y podemos llevar a cabo todo.
The participants selected the project to improve Oregon Park.
El parque ya existe, pues, lógico. Nomás necesita muchas mejoras. Ese parque adueñado por personas no adecuadas para llevar a nuestros niños, baños cerrados. Hay bastantes cosas. Queremos mejorarlo para tomar actividades y unir la comunidad. Si nosotros no decimos qué es lo que necesitamos, el gobierno o otras personas no van a saber lo que está pasando aquí.
Lo que ustedes están haciendo va a crear un impacto mucho mayor en su comunidad.
Gracias por acompañarnos, gracias por todo el apoyo que nos han brindado, y estamos muy contentas de poder participar en varios proyectos que hay aquí para la comunidad.
Los programas siguen continuando, siguen ofreciendo diferentes entrenamientos y ojalá puedan ustedes participar en alguno de ellos y unirse a la causa. Es muy bonita causa por esta misma comunidad y por la salud de sus propios hijos.
It's important for us to shift our lens in the way we're doing public health work, to give power back to the residents and people in community, to ensure that their needs are being met, to ensure that they have a voice.
And we really want to make sure that we hear from all voices of the community, that we don't just hear from the loudest voices.
So we want to partner with the community and create opportunities and different forums so that we can hear what they would like us to do and then also hear from them what they think is necessary.
Join us, because we can't do this alone. We need the community's voice.